Andy Johnson, Minnesota State University, looking at diagnostic reading assessments, sometimes called informal reading inventories, and their place in the IEPs. I don't like informal reading inventories because it somehow denotes less than. So diagnostic reading assessment. First of all, realize that this is an outdated model, the phonological processing model. Words appear on the page, we process it, it goes up to the cortex. Yet, most standardized tests are based on this model. The transactive view of reading, which is supported by the latest research in cognitive and neuroscience, says that we use 3 cueing systems and that more information flows from the cortex down than from the thalamus up. Reading is an interactive process using the 3 cueing systems: phonics, syntax, and semantics. All right, this is an actual student, Pat, a 4th grade student, from her actual IEP. As you read the first part of it, ask yourself, what does this tell us? How might a parent interpret this information? First part of an IEP, present level of academic achievement and functional performance. Pat's overall reading score, 9th percentile. Lexile score, she did not meet the 4th grade reading standards. Okay, tells us what she cannot do. Overall grade was 195. Lexile score, 511. She is in the low range, 11th percentile, right about there. All right? A lot of these scores and numbers and letters, blah, 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 get in the way. Make us look important like we know what we're doing, but does it communicate with parents? Nay, I say unto you. All right, 11th percentile, 50th percentile, that's average. It tells us how far away she is from average. Part 2, DIBELS. Data indicates she is intensive at the 5th grade level, related to reading fluency. I have no idea what that means. I have a PhD in reading. I may not be very bright, but I should know what that means. She is progress monitored at the 2nd grade level and has reached the benchmark of 85. This is correct words per minute. It sounds very impressive. Ooh, benchmark, all right? But not consistently. Her past 3 scores were 97, 80. Okay, we don't know how that compares to an average or norm. Well, there's the benchmark, all right? DIBELS is not a valid assessment of reading performance. Know that first and foremost. And we'll talk about DIBELS in another video, but it is not supported by peer-reviewed research. All right? The third part, Pat recently completed a decoding B1 mastery test. All right, this is Triumph's, a reading intervention program. That doesn't tell us anything. We don't know what Triumph entails. However, they give us scores and percentages. And of course, 5 out of 8 and 10 out of 13, that's not really sufficient numbers to draw percentages from, but we use numbers and we think that it's somehow more important. So what? Why? Does this inform or confuse parents? Does this inform instruction? Does this tell us the cause of Pat's reading difficulty or what to do about it? We already knew that Pat had trouble reading. We knew this. So what? Percentile rankings. Again, tells us the distance from average. So what? This is average. This is your child. And by the way, in any school, half the children are going to be above average and half below average. So if someone says to you, my goodness, our schools are failing, half the children are scoring below average. Well, that's normal. Standardized tests can be very valuable tools if used correctly. They give us a sense of where students are at, and they help us support the need to get special services. However, they can be equally destructive if used inappropriately. And again, bell-shaped curve, normal population, half are above and half are below. Norm reference tests are designed to compare students' performance to other students. Norm reference tests give us a general sense of students' reading in comparison to other students the same age. There should be apostrophe there, sorry about that. Standardized tests are not effective tools to diagnose the specific cause of a reading disability. Standardized tests are a very artificial reading situation. They do not make full use of the 3 cueing systems: semantics, phonics, and syntax. They are not effective in describing students' strengths and weaknesses related to reading. Again, it's a very artificial testing reading situation, and they are not appropriate for planning instruction, and we'll show you why. Standardized test data, which include norm reference and criterion reference tests, should never be used exclusively. Do not quantify our children. Beware of the fallacy of numbers. We put numbers behind something and we think it means something. Always include other types of data, and I recommend some form of diagnostic reading assessment. These are sometimes called informal reading inventories. These are more appropriate for describing students' present level of reading performance because it's based on a more authentic reading situation. For determining measurable annual goals and planning instruction. A diagnostic reading assessment usually includes a miscue analysis, word identification scores, fluency rates, and comprehension. Here are some examples of diagnostic reading assessments, and you can stop and pause, and you can go on Amazon or other places and click and get used copies or see what people have said about these things. And this is just kind of an overview of diagnostic reading assessments and the limitation of standardized tests, especially for IEPs.